So as far as the government is concerned, we are now at the stage where what we are doing is looking forward. I think we've done the work of ensuring that the Health Authority has its Nightingale facility, that was a big challenge, has all the facilities necessary at St Bernard's, cleared the deck of beds of people who were there for elective purposes, etc. So really the government is now looking at how we unlock what the future prospects economically for Gibraltar are, and that is about looking for new opportunities and what chances we have of getting back some aspect of the economic activity that we saw and we were used to seeing, and how quickly that can come back in the context of 2020, if at all possible. So let me just break that down for you a little bit. There is Task Force Restart and Recover, which is about how we come back from lockdown, how we open the institutional services that government provides, like schooling, etc. When does that happen? What effect does that have? Does that bring COVID back in some way? Do we see the curve become steeper? All of that aspect of work. And also, how do we preserve the good things about the work that has been done in the context of delivering lockdown? So the digital interaction between government and the citizen, which I've been trying to bring about for 8 years, and in 8 weeks we've been able to achieve more than we have in 8 years. How do we preserve the good parts of that? And Samantha Sacramento is looking not just at the management of the civil contingency that we're in, but also as how we emerge from the civil contingency, keeping the good. Then Task Force Future, which is about taking opportunities that have arisen in this period and trying to gain from the economic meltdown that we've seen around the world, those strands of potential new business that might come to Gibraltar in future. So that's how we're trying to skin this cat, and we can only do this with the support of the whole community. So a lot of what TFRR and TFF will be doing is reaching out to the community, to the business representative organizations, to the unions, of course, but also more widely to the general public, to Gibraltar, and saying, right, how do you think that we can do these things in the best possible way?
You mentioned the fact that potentially loosening restrictions and restarting economic activity, or at least some of the government's institutions, might see a rise in the number of cases. But that's almost inevitable, isn't it? Public Health Gibraltar has advised that most of us are going to need to get it. We can't wait out for the vaccine, can we? I mean, that would become economically unsustainable.
So the science on this is not yet entirely clear. I mean, you will have heard some people in the United Kingdom talk about herd immunity. There is some talk that herd immunity might not be possible if there is reinfection. There is a question of whether a vaccine in itself is possible in respect of coronaviruses, and whether the effect of the vaccine is only to cover 30% of the population. So all of this is very vexed at the moment. We need to continue learning. There is the question of contact tracing using mobile phones. The Google and iOS developers are looking at that. We're working with NHS England on that. More aggressive testing, so that Gibraltar's already, I think, 4th in the world ranking of how much testing is being done. We may want to push that even further. We may want to have different types of testing. There is another side to that, which is to look not at how you stop it from spreading, but how prepared you are. So do you say, right, we stay on the front foot in the context of having ICU bed capability, of having a Nightingale capability, which means you wouldn't be able to open the Europa facility as a sporting facility, but you have a health service that can deal with a surge, and you decide to go for a surge. Now, frankly, I think that's very unlikely to be our position. I don't want to risk any Gibraltarian lives. Exactly. I don't want to risk any Gibraltarian lives. I think that we have to try and preserve as much life as possible. We also need to get back to life as we know it as soon as possible. So that is the balance that we need to understand, and it's not going to be easy, and there's going to be a lot of opinions on that.
It must be a really tricky one in respect of messaging as well, because on the one hand we've been telling people that they need to stay at home to stay safe. If the economy needs to be restarted in order, at its most basic, to pay for the health service, right? Because the GHA needs to be paid for. Some people are going to see that as weighing out economic interests and money versus health.
We're never going to be putting economic interests before the health of the nation, because our first duty is the safety and security of our people. But in order to be able to provide safety and security for our people, we have to be able to afford that, and therefore we need to have an economy running. That's not to put finances before life, that's to ensure that you have the finances to preserve life. And it is a difficult balancing act, and we have to get it right. That's why we've gone for a very large chunk of borrowing, not just to be able to sustain people in employment, where in respect of our beat COVID measures, what we're trying to do economically is preserve employment and make sure that people have money to put food on their table, but also from the point of view of ensuring that we have the finances available to fund our GHA and to fund our public services, so we can continue to provide public services to people in Gibraltar and people in our economy.
Have the rules, or should the rules on borrowing be rewritten?
So look, I think the rules of life have changed, and I think that you'll see that from how politics operates in future to how public finance operates in future. And I do think that we need to have regard to the rules of public finance in Gibraltar, in particular if we're able to keep to them, because I think that will tell a story about Gibraltar as a community. Now, other overseas territories also work on the basis of a recommendation from the United Kingdom, which we've put into our law, into our Borrowing Powers Act, that says that you don't borrow without a resolution of the House more than 40% of your GDP, which means you can borrow more than 40% of your GDP with a resolution of the House. And the discussions that I've had with the Leader of the Opposition and Mr Clinton on this in the context of our general cooperation in respect of these matters is that we're going to, of course, try and stick to that limit. But if you got to a stage where you needed to exceed the 40% limit of borrowing to GDP ratio, and the reason for that was dealing with this public health dilemma, the government would not hesitate to bring to the House a resolution to exceed that borrowing limit. We're not anywhere near that. Remember that we can take up to £500 million of borrowing because of the gap that we had from our existing borrowing in order to be able to deal with this crisis at the moment. We think that that is sufficient at the moment, but if we were to find ourselves in a situation 14 months down the road or at any other time where we needed to exceed that, I would go to the Parliament and I would explain that why that would be the case, and then we would have to see whether that resolution enjoyed unanimous support in Parliament or whether it passed by government majority. I can tell you that I might even bring a piece of legislation, an amending piece of legislation, to change that provision in the Borrowing Powers Act if I had to, so that we could do that without resolution. But I think resolution is a good way of doing it because you give the explanation to the House and you obtain the additional borrowing if you have to. But at the moment, I think trying to maintain that ratio is good discipline.
BEAT allows for individuals who are not able to go to work at the moment because of the restrictions to claim money as employees, but it's less money than employees get in the UK, for example. Are you satisfied that it's enough?
Well, I think it's more money than most employees will get in the UK, and it's quicker money as well. So in the UK, you've seen an announcement which is about 80% of your salary up to £2,500, but then you've seen huge criticism that that money is not going to materialise until June because the assessments will be very difficult. There'll be very few people applying. If you look at the percentage of the working population that will be eligible, Gibraltar will have a larger percentage of the working population eligible for the measure that we've put in. Look, Roy Clinton said in the Parliament when we had the initial discussion in our emergency budget that we had to have something that was effective and didn't suffer from red tape. And that's exactly the position that the government was taking as well. And this is what we have designed in BEAT. What we're trying to do is to give you the money that you need if you're an inactive employee to put food on your family's table. This is not about preserving a lifestyle. Most people will have the benefit of being able to write to their mortgage provider if they have a mortgage and say, I can't pay my mortgage for 3 months. They'll be able to benefit from other aspects of what the government is doing. So this is about ensuring that you have money to put on the table. In fact, many people in our economy will find that they have more money under BEAT than they do when they're not on BEAT, because if you're on the minimum wage, your minimum wage suffers an element of PAYE, not much because most of that is excluded from taxation, but you suffer social insurance. You're going to have the full minimum wage now without social insurance. You're going to be earning more per hour doing nothing at home. That's why this has to be for a limited period and for the purposes of this emergency. Some people earn more than the minimum wage. They will find that they get less. So they're going to take home enough to put food on the table, but the alternative is unemployment. And what we try to do with BEAT is A, to preserve employment, and B, to preserve the basic income. And I think we're going to be able to do that in a very efficient way in time for the end of April, giving employers the money to pay their employees, something that is not the case in the United Kingdom and in other economies, where money is going to take a lot longer to get to the people who need it. And then we're going to look also at who is eligible. So if I can describe the BEAT measures to you in three broad terms, you've got the sectors which are obviously included because the government has closed them down. We're responsible for them not being able to operate. Restaurants, bars, retail, etc. Then you've got those sectors which we thought would be able to continue operating, but have got in touch with us and said, look, actually, we found that we are operating at 25% of our capacity. And then you've got the excluded sectors, those sectors which can continue operating, but there is a worldwide economic downturn and that is affecting them too. So the included sectors, very easy, set out in our regulations, will be able to designate as inactive all of their employees, and they will be able to take the minimum wage equivalent, the BEAT measure. Those who we thought would be able to continue to operate, well, we've brought many of them now entirely within the included sectors. So today, in the publication of our regulations, we've taken the excluded sectors again under advisement, and we've put more of those excluded sectors into the included sectors that will have the benefit of the BEAT measures. But what we're trying to do is continue to work hand in glove and in consensus with the opposition in respect of this period of 3 months that we've initially designated, and trying to listen to those sectors of the business community that are getting in touch with the government and saying that we have serious difficulties here.
GBC understands that certain wholesale companies are finding it harder on the basis that, for example, there are far fewer people coming across the frontier. We heard from the Deputy Chief Minister yesterday that cross-frontier traffic is down to 5% of what it was 12 months ago. So there are far fewer people coming across. So, for example, tobacco sales will be down, among other things. Is that one of the aspects that you're looking at?
So in fact, one of the things that we are very keen to do is to understand how sectors have been affected. The transport sector, the distributive trade, has been affected in great measure because a lot of the big supermarkets do their own transport. So we've looked at the transport sector, we've included them now in being able to access BEAT, even the couriers, etc., although they continue to have activity, not as much as before. We looked at the wholesale sector, and we've divided that wholesale sector into two. There will be a wholesale sector which is entirely affected, and that is the wholesale sector where the wholesaler does not have a wholesale tobacco license. They will be able to be included in these measures if they've got inactive employees. And then the wholesale sector where there is a tobacco license will be an excluded sector, because although sales are down, we don't want to promote tobacco sales. We want to ensure that people still see that the government considers smoking to be a bad thing. And we do nonetheless appreciate that tobacco wholesalers have been making a very tidy profit in the past, and 1 month cannot, or indeed 2 or 3 months cannot, undo their business. The tobacco wholesalers will have taken a lot of profit out of their businesses, and we will expect them to put some of their profits back as shareholder investments into their business to continue to pay their employees at this time.
And in respect of government revenue, is that an issue? In respect of tobacco and other commodities that are the sales of which are down?
Oh, I see. So in the context of government revenue, all of the strands of government revenue are going to be seriously affected, whether it's import duties or taxation, etc. Remember, the government is waiving PAYE and social insurance, so all of the strands of government revenue are down. And that's why the borrowing that we're looking at deals not just with what we are spending, but also what we are failing to recover from the economy, which means that we need to be able to make our spending in future at the same levels as in terms of the cost of the public sector, etc., dependent on ensuring that we bring back the economy, and therefore we bring back the revenue. That's why we need to have the stimulus measures be ones that we can afford.
We've seen that in the UK, the equivalent to BEAT also includes businesses themselves insofar as grants and also loans, but we haven't seen anything in that respect in Gibraltar yet. Is that on the cards?
What is on the cards is that people should understand that we have also seen beat as having three stages. The first stage, which we announced during the course of my emergency budget, and indeed I announced, I think on GBC in a press conference before I went to Parliament, was the measures designed to support businesses. So businesses will have a holiday in terms of business rates, they will not be paying a certain of their dues, and some of them will be waived or deferred. And those are set out in the guidance notes to the Beat COVID measures. And that was the first thing we did, was try and protect businesses. The second thing we did was try and protect employment and employees by the Beat COVID measures, which are designed to ensure that employees get the money that they need in order to be able to survive. The third stage, which is the stage we will be working on next, and I'm convening a meeting of the CELAC to look at this, and we agreed in the CELAC that we would do this in these stages, is the stage where we look at what else businesses now need in order to continue through this period and re-emerge. So that will be the potential for loans, grants, the support of commercial lending to businesses, and indeed other potential help that we can give to those that want to ensure that they're ready to emerge from this emergency to take the best opportunities available. That's a difficult process to ensure we get right. Remember that we've shut down the ability to dismiss employees. It's clear that at the end of this period, we will have paid for a lot of employees, but they may not be needed in businesses, and we cannot force businesses to keep employees forever. You might say that this has hit us almost at a period of boom, with the largest number of employees in the Gibraltar economy at any time, and that we may find ourselves in a situation in future where that number of employees has to come down before it comes up again. So you will see some people becoming unemployed. My role, of course, will be to protect national employment. That's what people have elected me to do. So I'm going to do everything I can to ensure that at the end of this process, anybody who has to become unemployed is not a Gibraltar resident. Okay, let's be clear about that. But in order to ensure that we reduce that as much as possible, businesses will have to have further support beyond the support we've already announced, and that is targeted at businesses, not just at businesses' ability to retain employees. If you look at the work that's been done in the United Kingdom, it's also been roundly criticised for not being available in the time necessary. We want to ensure that when we do that next stage, we also do it in a way that is as expedient as possible. And we're not the UK, we're much smaller. We're able to do things a little bit more nimbly and a little bit more fleet of foot fashion.
If we move back to the steps to loosen the restrictions and encourage economic activity carefully with due regard to public health, as you've said, are events in Gibraltar going to be dictated to a certain extent by what happens in Spain?
So if you look at what's going to really affect us the most, and Dr. Batty put this very figuratively when he talked about us being a dry bush between two raging fires, I would say three raging fires potentially. We have to be careful that international activity does not impact on us in a negative way, whether that is Spain, the United Kingdom, or Morocco, who are also in lockdown and with whom we have direct links, but indeed with the rest of the world, because somebody can come from the United Kingdom having stepped off a flight from anywhere in the world. And whilst there is one person in the world with this virus, you'll see it spread in the way that we have seen it spread, because it originated in one person. When it was declared to have happened 3 months ago, it's already now infected 2 million people. So we have to manage risk in the way that we ensure that we don't see a surge in Gibraltar. Therefore, we will be impacted principally by what happens in Spain. The Iberian Peninsula is at the moment one of the worst affected areas, and we're part of the Iberian Peninsula, and we managed to stave off the worst effects of the virus. We need to ensure that that's what we continue to do going forward.
Okay, and in respect of how we do that, have you taken any view as to whether it's a staged approach?
So I think undoubtedly this is going to be a staged approach to how we re-enter normality. What we've got to do is ensure that whether you're a cross-frontier worker or you're a national worker, the way that we work in the future changes to adapt to these eventualities. Now that might mean social distancing. It may mean, although the science on this is not clear, using a mask in areas where you cannot observe social distancing rules. It could mean teleworking as often as you can, even if you work in an office where social distancing can be observed, but you're probably safer at home on the days that you can be at home. So we've got to realize that there are no clear answers here yet. We have to keep searching for those clear answers and make prudent decisions going forward.
In your Easter message, you talked about a new strength of character being seen among the Gibraltar community, among a new generation. You also talked about life will need to be different, challenging, you said, and you asked individuals to do more for Gibraltar. What do you mean by that, do more for Gibraltar?
Look, it's important that we start to think as a community, that we stop thinking about ourselves as individuals and what it is that we can milk this cow called Gibraltar for. When the time has come, we have been able to have a GHA that's ready for a surge of cases. If we continue to try and milk this community more and more and more, the time would come where Gibraltar would not be able to have 55 ventilators available in the event of a surge in ICU, where we would not be able to provide a Nightingale facility of the sort that we are providing. Look, we have to preserve our ability to do those things as a community, and that means being less concerned about what Gibraltar does for each of us individually and more concerned about what it does for us as a collective. So people are, in some instances, selfish in the way in which they approach rules. That has to be an innate approach. And what I'm calling on my fellow Gibraltarians to do is to ensure that they don't fall into the trap of trying to abuse this place we call Gibraltar for their own specific selfish benefit. Let us think as a community. I think the words of John F. Kennedy are so overused that I don't like to quote them. But this is the moment when people need to start to ask themselves what they can do for Gibraltar and not what Gibraltar can do for them. And that is a moment which I think in our history has come before. It's come to the evacuation generation, to the generation that faced the referendum, to the generation that faced what you might call the siege of Gibraltar in 1969. And it's a moment that's coming to, it's a moment of reckoning that's coming to. It's my role to lead Gibraltar to understand that this moment has come and that there is no free ride after this. There is no more, where do I put my name down for free money anymore. This is now about understanding that we have to pay our dues to have the community that we want, that provides the copper bottom guarantee when the time comes that we can have those ventilators, we can have that GHA, we can have continuing scholarships for our children to go away to university, etc. But that means stopping the abuse.